So as everyone is here for the event, the topic is so attractive that we all are here. But let us know something about the organizer ISM Warriors, which is organizing it. Guys, ISM Warriors is an initiative by students of IIT ISM Dhanbad to increase awareness in society and provide all kinds of support to people in dire medical needs. We have also helped many people during this hard time of second wave in the COVID-19 pandemic. Yes.
And well, with that, everyone knows who we are and what we do. So with that, I'd like to present a piece of information for you all. Did you know today is 23rd October? Everyone knows that. But today is the National Mole Day. Yes, the chemistry one. I think everyone here is familiar with the concept mole. Today is the National Mole Day. Mole Day is observed in the honor of Avogadro's number. Everyone studied it in their JE times, I think. And it is marked from 6:02 a.m. to 6:02 p.m. Because that's the number. And it is observed on 23 October every year. And it is observed by, it is annually celebrated by everyone who is related to chemistry, all the chemists, the chemistry students, and the whole chemistry community worldwide.
Yes, exactly. Today, thank you, Praka, for saying that it is a National Mole Day for all those who are not aware of, and to illuminate today's day and to glow out this Mole Day and the today's event, we have our beloved Professor Parthasarathi among us. Guys, he is the associate professor in the Department of Chemistry in Indian Institute of Technology, ISM Dhanbad, which is our college. And he is an expertise in organic chemistry and organic synthesis and medicinal chemistry. So he has received a lot of honors and rewards, and he has received many. And most of us as sophomores, they all have studied under sir's guidance. So we welcome you, sir. And before we move ahead, sir, we would like to request you to address us while saying something about what is the future of this field of research on the basis of cancer treatment. So over to you.
Okay. Good evening to all of you. So it's a really pleasure. It's a pleasure from my side. Thank you, Warriors, and I think it's a fantastic initiative. And at the time moment, I think this is one of the best one that you guys are doing. And I think as if you see, the awareness is the first step to the prevention, you know. So that's what all we say. I think doctors, hopefully they will be agreed. Okay. So being an organic and medicinal chemist and working in the pharmaceutical world and then come into the academia. So it's a really privilege to see in the very much into the front side how the small molecules and the drugs are particularly used today world in the particularly treatment in the cancer treatment, or when you are doing the awareness of the breast cancers. So I am a privileged researcher, so who during my postdoctoral study at Harvard, so I was associated with a molecule which is called halaven, the eribulin. Okay, this halichondrin B, the molecules has come from. Okay, and I was directly associated when the drug discovery process was going on in Harvard, because this molecules has been named in halaven, so it's come from Harvard. And this is a treatment, present day treatment for the advanced stage metastasized breast cancers. Okay. I think Dr. Sinha is going to agree with me. This is one of the best treatment today. Okay. So that is one of the, I always cherish myself association with the this kind of molecules when I was a chemist doing my postdoctoral study at Harvard in USA. And then followed by, I have a lot of other opportunity to work with particularly with the forefront team members, like clinical trials with the doctors. and of course other pharmacologists. When I was championing the chemistry in the Dr. Reddy's laboratory at Hyderabad. So in the discovery research, okay. And particularly the areas we are working for the mostly the kinase inhibitors, and we are a lot of tyrosine kinase inhibitors, and which are very frontline treatment today, like molecules called lapatinib. Okay, so which is a frontline treatment for a breast cancers. So that way, as a chemist, I really enjoyed my working with the interdisciplinary team when it comes to the synthesis, when it comes to the medicinal chemistry or doing biologicals with the biologist, and then eventually toxicology and the clinical peoples. Okay. And always, of course, awareness is important, as well as then followed by treatment is also important. And so being whether you are a chemist or you are exercising chemistry or you are exercising the engineering, today everything is highly interdisciplinary. Okay, so we won't say that, well, I study science, or I don't have that kind of knowledge, or I'm an engineer, I do only this much of things. So a pharmaceutical world is a completely different world. So when you want to pursue the career in pharmaceutical industry, so you have to work with a lot of people, starting from engineers, from chemists, from the market, from the clinical trials people. So that was a very, very interesting part. I think this kind of awareness also gives some kind of ideas where exactly today's science and technology behind to this kind of awareness, and where the clinical people like who are doing the clinical practice, so where the science is coming, where the technology is coming. Today you will be surprised, you will be very happy to know that 2 organic chemists this year has been awarded the Nobel Prize in chemistry. And that's the only the synthesis of the molecules which is going to enrich the pharmaceutical world. Okay. So once the molecules are not coming, the product are not coming today, so there is no product into the market. You just think about the remdesivir. So if the remdesivir is not synthesized properly, it's not market, the COVID-19 treatment will not be successful. Okay. So that way, I think my things, my research area, so what we do also in the IIT ISM Dhanbad here, so my laboratory, my group. So you will be very happy to know, very recently we have been synthesized the molecules called molnupiravir, which is a very frontline clinical trials today in phase 3 clinical trials for COVID-19 treatment. And this has been synthesized in IIT ISM Dhanbad in this chemistry department. So you'll be very happy to know about that. Yes, so all these things are good sign as a chemist. So I think it's a very happy moment, and awareness is first, then followed by treatment. I think doctor will agree with me, and I think all of you guys will listen more and more story and more practical story from the doctor's perspectives. And I want to congratulate each and every one who has really championing the show today. And it's my pleasure, and I am honored to be part of this show. And I really very much interested to listen forward for Dr. Shubha Sinha. So what is his experience, his expertise, and all these areas. So I think it's definitely, it will enrich us and it will help us to fight this kind of diseases. Okay. So with this note, I'm very happy. So only things that I may not be the whole show, but again, I will come back because I have to attend one more webinar. So I'm presently heading the department. So thank you very much. So I have some other opportunity. Okay. Welcome, Dr. Shubha Sinha.
Thank you. Thank you, sir. It's an honor to, present a webinar in which you are present, sir.
Yeah. Thank you very much. Thank you very much. It's a pleasure. And go ahead, ISM Warriors. It's really fantastic. Thank you, guys.
Thank you so much, sir. Thank you so much. So with that, sir has spoken, and now let's address for what we have come upon. We have all gathered together. We all know the Breast Cancer Awareness Month is going on. Some days back on 19th October, we celebrated the International Day Against Breast Cancer, intending to raise awareness and promote women's access to timely diagnosis, effective controls, and treatments for this.
In this age of women's empowerment, we are giving so much opportunity for women's sense of self-worth, their ability to determine their own choices, and their right to influence social change for themselves and for others too. But in this journey, we somewhat fail to be aware and take precautions of our beloved against this breast cancer. Breast cancer remains the second leading cause of death among women. The chance for the women will they die for the breast cancer is about 1 in 39, like about 2.6%. So unfortunately, many of us are clueless about what it is.
Thank you, Harshda. So I guess now we all know the gravity of the situation. And to know even more about it, for enlightening us and opening our eyes today, we have a very special evening planned for you all. And we have a very special guest among us who is a consultant breast onco surgeon at Apollo Hospital CBCC, Ahmedabad. She has an experience of more than 8 years as a specialist in her field. Harshda will tell you something about her professional work.
Yeah, talking about her professional work, she is running with so much things right now. But there are so many things, but yeah, we would like to speak about what she is doing. She is an assistant professor in the Department of General Survey, Dr. D.Y. Patil Hospital, Navi Mumbai. She is also a clinical associate in the Department of General Survey and the Department of Surgical Oncology at the Leelavati Hospital and the Research Center in Mumbai. She is also a specialized registrar in the Department of Surgical Oncology at Asian Cancer Institute, and also a consultant breast surgeon at Bharat Cancer Hospital in Surat.
Well, we have already told you a lot about her. Even she has also been a faculty in various conferences, published in various peer-reviewed journals, and has been presented in various national and international conferences. With that,
without creating much suspense and without having much ado, ladies and gentlemen, please welcome the epitome of energy and the representative of pureness, the magnetic demeanor, and our today's guest, Dr. Shubha Sinha.
Thank you. Oh my God. Thank you for such kind words. So all of us are here, as we all know, October is the Breast Cancer Awareness Month. So just learn few things. See, it's very easy to celebrate. Could you please start screen sharing so that I can share my presentation? Yeah, so it's very easy to just celebrate 1 month as a breast cancer awareness month. But what we should aim for is that we should not only celebrate just a month, but we should try and make each and every person aware, whoever comes in our contact, about the disease, not only for this month, for a whole year round. And unless and until we teach other people who are not so, educated, or who don't have access to resources. So we should try and teach all those people, because still in our country, breast cancer is a disease which causes maximum mortality. It is the first cause for death, cancer deaths in females. So let's try and educate each and every person. Has the screen sharing? Yeah. So this is how the cancer cell, it looks when you see it below the microscope. These are all these tentacles, these crab-like tentacles of those cancer cells. So what exactly is the cancer? In our body is made up of cells, right? So whenever any cell, it undergoes any damage, any kind of damage, it becomes a mutant cell, just like a ninja turtle, right? So the cell becomes mutant. And then there is no body check which is acted on it. So without any check on it, it keeps on growing. It keeps on undergoing more mutations also, more mutations, and without any check, the cells keep on growing. and they keep on accumulating, and it forms a tumor, which is known as cancer. I don't know why this is not going forward.
I think it's lagging a bit.
Yeah.
Ma'am,
So
if possible, actually, ma'am, if possible, you can send the presentation to us, and if there won't be
Yes,
a problem, someone
I
from
will
us.
just do that, and you can screen. Just 2 minutes. So
Shivani, can we
this
do that?
can.
Yes, yes,
You
yes.
can do that.
Ma'am, you
Yeah.
can send us and I'll share.
Yeah, I'm just sharing it with you. So this cancer, which is growing without any checks, this can happen anywhere in the body. It can happen in blood. It can happen in any of your organs. And if this happens in breast, it is called as breast cancer. So breast cancer is just one word given to cancer which occurs in breast. But breast cancer in itself is a group of diseases. It is not just one disease. It is a group of diseases which has been labeled as breast cancer because it is cancer occurring in breast.
Yeah,
I
ma'am.
think now it is moving, right?
Yes.
So
Yes, ma'am.
yeah, so now like you can see this cell has undergone a change, and it keeps on growing without any check, and then it forms a tumor. If this thing happens in breast, it is called as breast cancer. What is a normal human breast composed of? It is composed of three things, that is fat, glandular tissue, and connective tissue. Glandular tissue is the part which produces milk while breastfeeding. So these are the glands. So these things are called as lobules, and these things are called as ducts. So milk is formed in this lobule, and then through this duct, it goes in the nipple through to the kid. If the cancer can occur either in this part, which are the lobules, or it can also occur in this part, which are the ducts. So cancer occurs in these two parts. As we all know, it's the commonest cancer among women worldwide. Earlier, we used to say that it is the commonest cancer in urban women and second commonest cancer in rural area women. Now it is commonest cancer in both urban as well as rural. So as you can see, the red thing, this represents our current scenario of breast cancer. So earlier, more than 25 years back, maximum cases used to occur in female who are more than 50 years of age. But that is not the case in present scenario. Now the age is decreased. So commonly it occurs from 25 to 50 years of age. So why are we so concerned about breast cancer now? Not only the incidence is increasing, but also the incidence in younger age group is increasing. So recently, if I see in past few months, the youngest patient which I have treated, only past few months, the age was 19 years, 19. So that is how young we are talking about. So incidence is increasing. Of course, that is not very common. The commonest age group now is 25 to 50, but yes, it does happen in younger age group as well. So we should be aware about that. If we talk about urban cities, for example, Ahmedabad, I'm based in Ahmedabad, or for example, Ranchi or Patna, so the incidence is around 30 to 32%. That means if 100 female patients are coming with cancer to the hospital, out of those 100, 32 would be having breast cancer. Out of all cancers, 100 cancers, 32 would be having breast cancer. So the incidence is increasing, and most commonly 25 to 50 years of age. So this last year, more than 1 lakh new women were diagnosed with breast cancer in India. The diagram which you see below, 1 in 8 women will develop breast cancer in their lifetime. Actually, that is Western data. Thankfully, now we have got Indian data as well. And it is good for us that now it is 1 in 28. The India data is 1 in 28 women will develop breast cancer in their lifetime. In our country, sadly, most of the patients who come to us, they come in very advanced stages. So, and the more advanced the stage, the long-term survival of the patient keeps on decreasing. If we detect the disease early, their survival increases. Why we are talking about awareness and screening is because we can detect breast cancer in pre-cancerous stage. That is when the cancer has not yet formed, what we call as carcinoma in situ. That can only happen if we screen all ladies for breast cancer. Sadly, we don't have any national screening program in our country. Why Western population presents at early stage and we don't is because they have got national screening programs in which compulsory all the women are called for screening every year. We don't have any such program in our country at national level. So we should try and educate each and every person, whoever we come in contact, that all the women at the age of 40 years, they should get their first mammogram done. There is no need to repeat mammogram each and every year, but your frequency of when to do mammogram would be decided by your breast surgeon or your healthcare provider. But first mammogram, your 40th birthday gift should be a mammogram for yourself. How it will help us? Only and only mammo can diagnose the disease before the disease has yet formed. We can diagnose cancer. There are few signs which can tell us that yes, at this place, cancer can form in future. So we can treat the disease before it has even formed. And in that case, chemo can be avoided. Mostly radiation can be avoided. Only a small surgery would be required. Breast can be saved. In most cases, I'm not talking about all. So there is lack of awareness and screening. And sadly, even educated people in our country, they come with a large tumor. So the average size of tumor with which the patient come to us is 3 centimeter. If we have a 2-millimeter pimple on our face, everybody is, scared. They are running to dermatologists. Breast is a superficial, it's a surface organ. So it should not take that much of time for you to go to your doctor. Most commonly, breast lumps, cancerous lumps are painless. So the females, they keep on ignoring. They come to us only and only when they are so advanced that now they cannot ignore it. They come to us at that time. Till that time, it has already advanced too much. So by the time you have any symptom, your disease is already advanced. If you're ignoring your symptom and you keep on waiting for it to become significant, to cause you trouble, your disease is already too very advanced to even treat. So first of all, screening and awareness, which we should all, teach everybody. So why does breast cancer happen? Breast cancer is a multifactorial disease. What it means is there is no one single cause which can cause breast cancer. There are multiple risk factors which contribute to occurrence of breast cancer. Few risk factors are those which we cannot change, which we cannot never modify. And there are few risk factors which are modifiable. Let's see what those risk factors are. So the risk factors which we cannot change are, the biggest risk factor is gender. Being a female itself is the biggest risk factor. That does not mean that males don't have breast cancer. Males also have breast cancer, but of course, their risk is very, very, very less as compared to female gender. Age. As age increases, your risk of getting breast cancer keeps on increasing. If there is any history of breast cancer in your family, your chances of getting breast cancer increases significantly from those who does not have any family history. But that does not mean that others who don't have family history won't get breast cancer. It is not that. Of course, those who have family history, their chances are increased, but maximum patients who come to us with breast cancer, they don't have any family history. 9 out of 10 patients in our OPD, they don't have any family history. So nobody should ignore any sign in their breast. Worldwide, there is a population of Jews, which is known as Ashkenazi Jews. they have the highest incidence of breast cancer. In our country, it has been observed that people belonging to Parsi community and few areas in our western states are more prone to getting breast cancer. And people who belong to Jain community are little less prone to get breast cancer. But there has not been any national survey to, say that this race is more prone. It is not that. This is just a general which we usually observe in our clinic. If somebody has received radiation in the past for any treatment, radiation to the chest wall, they have got a little increased risk to get breast cancer. Somebody in whose family there are some known genetic abnormalities, genetic mutations, they are at very much increased risk to get breast cancer. Those are called as high risk families. If somebody belongs to high risk family, for them, all the rules change, all the screening programs, everything changes. For them, there are specialized clinics. And if anybody has known genetic mutation in their family, then they should be enrolled in those high-risk clinics and they should do their screening accordingly. If a lady or if a girl gets her period at a very early age and her period stops, menopause occurs at a very late age, that means her menstrual age is very big, then her chances of getting breast cancer increases. Why is that so? Because the estrogen exposure in the body increases. What happens in each and every menstruation is, each and every month, the uterus prepares itself for the incoming, that a baby is going to come here. So the uterus prepares itself for baby. So all the linings of uterus and everything, it increases. When at a particular time they get that, no, there is no baby, all that lining and all is shed in the form of menstrual blood. So each and every month this is happening, that the lining is increasing, then again the lining is shedding. So there is wear and tear. So breast does not have any hormone of its own, but all the hormones in the body are acting on the breast. So each and every month there is wear and tear. So that is why your estrogen exposure is increasing, which is increasing your risk for getting breast cancer. So if somebody gets pregnant, at that time, this wear and tear is not happening. So this hormone exposure to the breast is not happening. That is why we say that if you get pregnant, you decrease your risk of breast cancer. If you feed your child, you decrease your risk of breast cancer, because those 9 months and additional 1 year which you are feeding, all this thing is not happening in your body, the wear and tear, because of the hormone. You don't get any periods. So this, having kids, getting pregnant and breastfeeding your children, it decreases your risk of getting breast cancer. So the few modifiable factors of breast cancer are breastfeeding. Breastfeeding will decrease your risk of getting breast cancer. Now, obesity, like increase in weight, being obese after your menopause, it increases your chance of getting breast cancer. Why is it so? Because all that hormone exposure which is happening to breast because of menstruation, it is happening at a fixed interval every month in a fixed dose when a female is menstruating. But once the female stops menstruating, once she achieves menopause, the extra fat in the body, it starts secreting the sex hormones, the estrogen. But that secretion, it is not according to the schedule which happens in the body when she is menstruating. That schedule which is in the ovaries, that okay, this time of month, this hormone is released, then it is stopped. It is not like that. It will happen anytime, whenever the fat wants to secrete it. So that is why we say that once you achieve menopause, try to keep your weight as less as possible. More the fat, more your chances of getting breast cancer, because it is irregular, spontaneous. Whenever the fat wants to secrete estrogen, it does so. So a modifiable risk factor is not having children. If you don't have any children, your risk increases of getting breast cancer. The more pregnancies you have, you're decreasing your risk of breast cancer. As I told you, breastfeeding decreases your risk of breast cancer. Alcohol intake. Moderate to high intake of alcohol every week increases your risk of getting breast cancer. Exercise. The more you exercise, you're decreasing your risk. Regular physical activity decreases your risk of breast cancer. Hormone replacement therapy is a little controversial topic. If it is required for hormone replacement, you of course would take hormone replacement therapy, but hormone replacement therapy also increases your risk of breast cancer. So you should discuss it in detail with your doctor. Same for oral contraceptive pills. Oral contraceptive, some, not the newer generation, some oral contraceptive pills have cumulative effect. The more you take it, you increase your risk of getting breast cancer. But once you stop taking it, your risk decreases. So now the newer generation oral contraceptive pills, it does not increase your risk, but earlier ones do. So each and everybody who's taking OCPs should discuss the type and risk involved with your doctor. There is one more risk factor which significantly increases your risk of getting breast cancer, which all of us should aim that we should not have it, which is stress. The more you stress, the more hormonal abnormalities in your body, the more you are increasing your risk of getting any type of cancer, not only breast. So just sum it up, 38% of cancers, that is more than 1/3 cancer, won't occur if we maintain a healthy weight throughout our life. We quit smoking and we avoid alcohol, and if we breastfeed our babies, then around 1/3 breast cancers won't happen. In breast cancer, you cannot prevent breast cancer. We cannot say that, okay, this person will get breast cancer, so now you do this. You cannot prevent it. But earlier you detect, the more you are increasing your survival. See, breast cancer is the best cancer to have because breast is a superficial organ. You are going to detect it early. Breast cancer treatment has become very advanced, provided you come to us early. Each and every person should be breast aware. All males, all females, they should be breast aware. So what is breast awareness? Breast awareness is that you know what are the symptoms of breast cancer. Regularly, you are checking in your breast. If you encounter any symptom or sign of breast cancer, you are going to your doctor on time. That is called as breast awareness. Now let's talk about what is normal breast. How do you know my breast is? So the plain answer is there is no normal breast. There is no standard breast. For each and every woman, her breast is her normal breast. So there is nothing called as normal breast. You should know what is your normal. How would you know what is your normal? If you are examining yourself each and every month, then only you will know what is your normal. Even for a particular person, their breast is not same in 1 month also. Your breast keeps on changing according to your menstrual cycle as well. So there is nothing at all called as normal. You should know what your normal is. Why are we talking about screening? Is because screening would decrease the time when your breast cancer is being diagnosed. We can diagnose breast cancer at asymptomatic stage when you don't have any symptoms of breast cancer, or when it has not even formed cancer, like I told. That can happen only by mammogram. Self-breast examination should be started by all females when they achieve puberty, and even by all males as well. If you have breast, touch them, examine them each and every month. So few steps for screening are self-breast examination, which needs to be done each and every month. Clinical breast examination, which should be started only after 40 years of age, which should be done once a year after 40 years of age. It is not required to be done before that. Mammogram should be done once at 40 years of age. After that, how frequent you should do it, your healthcare provider will tell you, your doctor will tell you. Less than 40 years of age, we don't advise mammo unless and until you have any complaints. Then also your first investigation of choice would be ultrasonography. Then if there is any doubt, MRI would be done. If there is any doubt, mammogram would be done. The only case where mammogram is started at an earlier age group is when there is known genetic abnormality in the family. When there are multiple cases of breast cancer in the family, then mammo is started at 10 years earlier than the youngest age group who had cancer. Somebody had cancer at 50 years of age group, multiple people, and youngest was 50 years. Then if in my family there is multiple history of breast cancer, youngest was 50, I would start my screening at 40 years of age, but never to be done before 35. Somebody had at 45 multiple, they would start at 35, but mammo is never to be done below 35 years of age group. So self-breast examination is done every month. When is it done? 5th to 6th day of your periods. It has to be done. In women who have stopped their periods, it should particular date should be fixed and they should examine at that date. How is it done? So it has to be done in 3 positions. One would be standing in front of the mirror, one would be lying down on the bed, and third would be while having a shower with soap applied on your fingers. So first you need to see, standing in front of the mirror, is there any visible change in my breast or in my breast skin? Are there any visible lumps or bumps? Are there any skin changes? Then you put both your arms above your head and then see, are there any changes? Then you put both your arms on your waist, press on your waist, and then see, are there any changes? Then what you need to do is you need to palpate or touch yourself. How do you need to do that? You need to use these 3 finger pads, not the tips. These 3 finger pads, you have to press gently all over your breast and see for any changes, any lumps. Never hold or catch hold of your breast like this. If you hold like this, what you'll do is you'll catch hold of all those glands which are used to produce milk, and you can confuse them with lumps. You'll think, oh no, I have got breast lump. Although there would be normal milk gland, there would be normal breast. You just need to press gently. You have to start systematically. Either you go all around your nipple, go in circular fashion, or you start from your collarbone and go down vertically. You have to see whole of the breast. Areas which are not to be missed are areas below your arms, the underarm area, and the area below the breast. This thing you have to do in both breast. Left breast needs to be examined by right hand. Right breast needs to be examined by left hand. All these things needs to be done in 3 positions: standing in front of the mirror, lying down on the bed, and once in the shower. Any change which was not there, why we tell you to do it every month? So that if there is slight change also which was not there the previous month, immediately you can go and show it to your doctor. Clinical breast examination should be done annually for women above the 40 years of age group. For high risk patients, it is more frequent. It would be explained by your doctor. Mammogram never below 40 years of age for normal population. And for less than 40 years, you can undergo ultrasonography. So what is the commonest symptom of breast cancer? If it would have been an interactive live, I would have asked questions, but sadly, this is very boring. It is a didactic. We cannot help it in an online session. So I'll only give you answers. So commonest symptom of breast cancer is no symptom at all. That is commonest. That is where screening comes in play. That is where we can detect breast cancer before any symptom occurs. So some other symptoms which you should know for being breast aware are lump. Is there any lump or swelling in your breast? is there any nipple discharge, blood stained nipple, or discharge, or any other colored nipple discharge? Is the nipple pulled in? Are there any skin changes such as redness over the skin, dimples over the skin, ulcers over the skin, or any? Your skin can even look like an orange peel. So these are few symptoms which you should look for when you are examining your breast each and every month. So how do we diagnose breast cancer? So breast cancer is diagnosed always and always by triple assessment, not one. So if you think that there is any problem in my breast which was not there earlier, you'll go to your breast surgeon. They will examine your breast clinically, and then they will determine, is there any need for further investigation? If there is no need, then no further investigation would be done. They would only examine by their hands. If they think there is any need for radiological assessment, depending upon your age, either ultrasonography, MR, or mammogram would be done. If on mammo, ultrasound, or any other radiological investigation, it is determined that now there is no need for biopsy, there is nothing, no disease, no further thing would be done. But if there is any suspicious of cancer, a biopsy would be done. Only and only a biopsy can give you a 100% diagnosis of breast cancer. How the biopsy is done? There is no need for any surgery. So biopsy is done by a needle. It's a needle biopsy where there is a cord needle biopsy, which is like a pen. How when the lid comes outside and then it goes inside, the needle is just like that. So it goes inside your lump, it opens, and then it takes that specimen, and then that knife goes inside. It is always enclosed or encased in that gun, and then you take it out. So there is no risk of tumor spill or anything. Most commonly, why patients don't go for biopsy? Because there is a general notion in our country that biopsy spreads cancer. No biopsy spreads cancer. Biopsy is required for diagnosis. Why I am stressing so much on it is because patients from, interiors or rural places, what they do is directly they get operated somewhere by people who are not qualified to do surgery. They do get operated and come to us, increasing their stage of disease, spreading their disease. Why? Because they were advised biopsy from a doctor, but there is a notion that biopsy increases or spreads the disease. They don't get biopsy done. They just go outside wherever, they get operated. We cannot stage them properly. They come, they increase their stage. So everything, biopsy is required for your treatment planning. Biopsy is a must. Unless and until we know what kind of cancer we are dealing with, we are never going to operate or give you anything. So biopsy is a must. And biopsy never increases or spreads the disease. So now let's talk about how do we treat cancer. So breast cancer is never treated by one doctor. Any type of cancer is never treated by one doctor, and not all patients receive same treatment. Breast cancer is has got a very individualized treatment. It has got tailor-made treatment. Many a times the patients come to us, in our OPD, and they tell us, I was sitting with other patient, you operated that patient, but you're not operating on me. Why am I getting chemo and not that patient is getting chemo? She also has breast cancer. I also have breast cancer. So what each and everyone needs to understand is breast cancer is not a single disease. It is a group of diseases. It has got multiple hundreds of other diseases which we call breast cancer. Each and every patient their treatment plan is individualized. It is tailor-made according to them. What we are going to give you, how a tailor stitches our clothes according to our measurement. It is not. See, Small, medium, large, these are just size which fit you. So not everyone can wear small size. Not everyone can wear large size. It is all tailor-made according to our body type. Same, breast cancer treatment the plan is tailor-made to all individual patients. Some options of treatment are surgery, chemotherapy, hormonal therapy, radiation therapy, immunotherapy, targeted therapy. Not all patients are going to require all, and not even in the same, type. Like for few people, we can have surgery first, chemo later. For few people, we can have chemo first, surgery later. So everything is tailor-made. It is a multidisciplinary treatment. Not one doctor is going to treat all of the cancer. It's a group of doctors. There would be a surgeon, there would be a medical oncologist, there would be a radiation oncologist, there would be a radiologist, there would be a pathologist, there would be an immunotherapist, there would be a specialized nurse, there would be a specialized, for each and everything we have got a specialist. So don't go to a place which has got only one doctor treating all. Your treatment is never going to be right. Go to a place which provides you multidisciplinary treatment. Why I'm stressing? Because in our country, there is a trend that patients only, if we go to a normal hospital, they will say, for this, you go to this, for this, you go to that doctor. Here, only one doctor is treating everybody. What they don't understand is not one doctor can treat each and everything. So please go to a place where they are providing you a multidisciplinary treatment. Not only multidisciplinary, but where they practice MDT. What is that? In that, each and every case we discuss as a team, so that there is no room for error. If a single patient, if I am a surgeon, if only I am planning, I am seeing the patient and I am planning, okay, this patient requires surgery first, let me operate first, and then I will send to my medical oncologist. There are chances I may be wrong, right? But if I am discussing that as a team, I am keeping a file as a team where 10 doctors are present, and then I say, I feel that this patient should be operated first. I am right, everybody would agree with me. But even if there is a 0.01% charge that if we give chemo first, or if we give some other treatment first, then the patient may benefit a little more, then they would object. And then they would say, no, let's first do this, and then you operate. So the chances of error, it decreases if we are practicing as a team. So always go to a cancer hospital which has got something called as MDT, where there's MDT planning. So these are few things which even being educated, not everybody knows. So these are few things which you should know about. Just as I told earlier, the earlier you come to us, the earlier your cancer is detected, your survival increases. So the stage 0 is the one where the disease is detected when the disease has not yet occurred. This can happen only and only when we screen our patients. 5-year survival. That means if 100 patients came to us in stage 0, after 5 years, more than 95 would be alive. Actually, it is 100%. Why this 95 is more, at least 5 of them would have died from other cause, not because of breast cancer, because of some heart disease or some other. That is why we cannot give 100 number here, because it's rare that 100 people are alive, but they would not have died because of breast cancer. Stage 0 has got almost 100% 5-year survival. 95 is the number because that 5% morbidity or mortality is because of some other cause. But if same 100 patients are coming to us in stage 4, after 5 years, out of those 100, rarely 2 to 5 patients would be alive. So that is the difference between stage 0 and stage 4. Your survival decreases that much. From 100, it becomes 2. If somebody is coming to us in stage 0, after 5 years, all 100 of them would be alive. But if 100 patients are coming to us in stage 4, after 5 years, hardly 2 of them would be alive, 2 or 5, whatever. Still stage 3, breast cancer is absolutely curable. Stage 4 is the stage when breast cancer has spread to other organs of your body. Stage 4, breast cancer becomes incurable. That means we cannot cured the patient of the disease. But of course, there are drugs, there are methods to keep the disease in check, but patient would never be cured. Let's, no, just wait for 10 minutes, beta. Sorry. So let's break a few myths about breast cancer. There are lots of myths going around about breast cancer. So many a times, you know, patients or females, they really get worried whenever they do a self breast examination. There is a lump. You know what? Most of them don't come to us because they think it's a cancer. What is the use of going to the doctor? I'm not going. So 8 out of 10 patients who have got a breast lump, 8 of them would not have any cancer. It would be something, you know, benign or something else. So don't be worried. Even if it is cancer, don't be worried. Go to your doctor on time. Mostly it won't be cancer. There is only 2% chance that it is cancer. But if it is cancer, the earlier you detect it, the better it is for you. This is the most common myth. You will get WhatsApp forwards. You will get emails. I had heard this even on radio, FM, that don't apply deodorants, antiperspirants. It causes breast cancer. As long as it is FDA approved, there is no risk of breast cancer. You can use all those perfumes, deodorants, whatever you want. Okay, so people come to us that I had an injury, मुझे मार लगी थी, बच्चे का सिर लग गया, फिर गांठ बनी और मुझे कैंसर हो गया. So this is not so. What happens is that ladies, they don't touch their breast, they don't examine themselves. When there is an injury, at that time they touch their breast and they come to know, oh, there is a lump there, which they think is because of injury. That lump would have been there from forever, and now they think that it was injury, because of injury I got a lump. And then they come and then they think, oh, this cancer occurred because of that injury. No, injury never causes breast cancer. Only large breasted women get breast cancer. No, the fact that you have breast, you can get breast cancer. So no size cannot determine breast cancer. If we detect early, you are never going to die with breast cancer. So earlier you detect. Patients don't come to us even after detection of breast cancer. They don't come for treatment because they think I have to die. Why should I get myself treated? Why should I go and get surgery and chemo done? So no, you are not going to die. You are going to get cured. So stage 3, it is absolutely curable. So please get treated. No kind of bra, no color of bra, nothing. No, bra has got no association with cancer. You can wear any type of bra, any color of bra you want to. This I already told. Family history, of course, increases your risk, but it is not that if I don't have any family history, I'm not going to get. Most of the patients who come to us have no family history. So each and everybody should be aware. Men can also get breast cancer. The risk is very less. Incidence is 1 in 100. If 100 females come to me with breast cancer, 1 man will come. But men should be aware. All the more because in men, breast cancer spreads earlier. The amount of breast tissue is less in men. So if they get any lump, it spreads faster. So please, all boys, all men, please examine yourself. You also have risk of getting breast cancer. Could you please excuse me for a minute? I'll be back in 2 minutes. Sorry. I am sorry for the disturbance.
No issue.
Breast implants increase. So cosmetic breast implants increase your risk for breast cancer. See, that is not so. There were few implants which used to cause lymphomas, which are some other kinds of cancer. but they all have them been recalled. Now the implants which we get, they don't cause any cancer. But yes, there were few breast implants which had caused lymphoma in few patients, although the incidence was very less, but it was there. But now the implants which are available, they never cause breast cancer. Many patients think that we got treated for breast cancer, we got our breast removed, now there is no risk of breast cancer. See, that is not so. If somebody has cancer, their risk of getting cancer at the same place or somewhere else in the body is much more than from general population who has never got cancer. Even if you have got your breasts removed for cancer, the chance that you can get cancer in your other breast or at the same place where breasts were is there. So you have to be for lifelong follow-up. If you have got cancer, you have got treated for cancer, lifelong you have to be in follow-up. If there is risk of breast cancer in your family, you come in high risk group, please get enrolled in a high risk breast clinic. Same thing, exposing a tumor during surgery causes spread. Just like biopsy, there is a notion in our general population that surgery also causes the cancer to spread. That is not so. So in the end, I would just like to say early detection and screening. Always be breast aware. And early detection is the best protection which you can have from breast cancer. Thank you. Now, I think I see a few questions. Are there any questions in chat box, right? So you want me to take those questions?
Actually, ma'am, within your presentation, you have answered most of them.
Yes, I think so. Yeah.
Actually, those questions were coming right when you were presenting,
Right.
so some things were answered after those
Yeah.
questions.
Is it necessary to feel pain in breast? No, most breast lumps are painless. No clothes can prevent or cause breast cancer. Is it normal to have breast swelling during periods? Yes. See, slight amount of pain, patients will come to us. Pain is absolutely normal. Big lump, because it is painless, they don't come to us. Breast cancer never causes pain initially. Say hello. So it is absolutely normal to have breast swelling during your periods. So nothing to worry about. Inverted nipple, yes, it is a symptom of breast cancer. How quickly do I need to make a decision about breast cancer? What is the question? Sorry, I'm not able to read it. Let me enlarge this box. How quickly decision about, oh, once you have been diagnosed with breast cancer, immediately. There is no room for waiting. If you have been diagnosed with breast cancer, you have to get yourself treated. No pain. I have a query. Breast surgery and post surgery treatment में ऐसा क्या टेक्नोलॉजिकल लैग है जो एक सर्जन चाहता है कि वो ठीक हो या हार्मफुल हो? Okay, so at the moment there is no technological lag as such. There is lots and lots of research happening in breast cancer. Every day a new drug comes for treatment. New kinds of treatment are coming, so there's no lag as such. But post surgery we do advise few things to be done, like physiotherapy, exercises and stuff which patient needs to do. Okay, any other question apart from this?
Ma'am, as you scroll down, you will much. Yeah.
There are several questions actually.
Yeah, please go ahead.
I'll ask some questions which have been repeated. There's one question which has been repeated in several forms about the diet or the meals that we take. Are there some meals that can be taken and not taken to reduce the danger?
No, diet does not have, there is no relation of diet and breast cancer. Few papers, very less, few papers have said that plant-based diet decreases your risk of getting breast cancer and red meat increases your risk of getting breast cancer. But There is no direct role of diet in breast cancer. Of course, healthy weight is required, as it is red meat intake should be less because of all other diseases. So no, there is no restriction. Even when you are undergoing your treatment for breast cancer, there is no restriction of any diet in breast cancer. So no.
Ma'am, as lifestyle is being evolving every day, so like what are the mistakes we youngsters or the people in this generation are doing, or which leads to the breast cancer, ma'am?
Yeah, lifestyle factors are really important in breast cancer, more so because it's a multifactorial disease. Lots of risk factors are contributing to getting breast cancer. All of you, it's very good you all have started, listening about breast cancer, spreading awareness at such a young age. Everybody should have should do some amount of normal physical activities, normal physical exercises, limit your alcohol intake, stop smoking, and just maintain a healthy weight throughout your life. These are few things which you can do to decrease your risk. For all the females, try to have babies and breastfeed your babies. That will also reduce your risk. To all the boys out there, please don't forget to check your breast. Even if you are a man, you also have a risk of getting breast cancer. The males in their family who have multiple relatives with history of breast cancer, ovary cancer, prostate cancer, they should be all the more aware. Saying that everybody should be aware, but more who are at risk are those who have got these diseases in their family.
Ma'am, like we majorly covered about the diet and the lifestyle we are leading. And one of the major things which comes to breast cancer for a girl is the clothing type. Ma'am, is like wearing any tight bra for a whole day affects the breast, or includes a...
No cloth, wearing or not wearing, no cloth can cause breast cancer. Nothing, no bra, no cloth, there is nothing. If there would be something like, oh, wearing this cloth would decrease my risk, I would advise everyone to wear that. But no, there is nothing like that. Clothes do not contribute to breast cancer. Neither do they increase your risk or decrease your risk, nothing like that.
Okay, so ma'am, I think all the questions have been covered. Is there something?
Ma'am, one more general thing which Ashmita wants to know, ma'am, is there any particular age, like it's an age like below 30 or above 25? Is there any particular age for a woman, best age for a woman to be pregnant and to have a baby? Like
the more your age increases, risk to mother also increases, and abnormalities in having in baby also increases, such as genetic abnormalities like Down syndrome and all. Usually, earlier it was said that less than 30 years of age you should have your first pregnancy. In this day and age, actually it's not possible. We complete only our studies at the age of, after 25 or 30, we are getting married late, we are having our pregnancies late. And all these studies which have been done according to pregnancy and age, they were done, at that time when our lifespan used to be less. So now lifespan has also increased. Initial days, our lifespan would be, average would be around 50 to 60 years of age. Now it is not so, it is 80 to 90. So if you want, ideally before 35, you should have your first pregnancy all said and done. Be pregnant whenever you want to yet. Nothing like, you should have it before 35. Nothing like that. But yeah, in ideal world, it should be before 30 first pregnancy. But there won't be much effect at all. Ideally before 35 years of age. See, as mother's age increases, complications during pregnancy to mom and to your child also increases. So, but if somebody, it's personal choice. If somebody wants to have a pregnancy at a later age, they can have that. you should just be aware of, all your choices. So it is not that you should get pregnant, you should be pregnant before 30 or before 35 years of age. There should be something called as counseling, where they should go and meet their doctor so that their options are explained to them. There is no age you should not get pregnant or get pregnant.
Okay, ma'am.
Just one question, ma'am.
Yeah.
I think you have already answered this, but there's one question: whether breast cancer is communicable to the fetus?
No, it is not. There is something called as pregnancy-associated breast cancer, in which if your breast cancer is diagnosed when you are pregnant or within 1 year of your delivery, then we call it as pregnancy-associated breast cancer. It is a whole new disease because those breast cancers are really aggressive. They happen in young age, but never would be transmitted to your fetus. So nothing to worry about, but those breast cancer are more aggressive for the patient. So they are bad type of cancer if it occurs in anybody, but then also there is no risk of transmission to fetus. No, never. But your treatment plan changes because many things you cannot do in a pregnant patient. So that is that.
Yeah, ma'am. Ma'am, one more question from Rashmi. She wants to know, like, it's not related to cancer, but do bras, the shape or the way we wear, prevents sagging of breast?
No, not at all. Bras would never prevent sagging. Why sagging happens is it's genetic. If it's all according to body structure, no clothes can prevent sagging or cause sagging. No, it's all according to your body structure, body type.
Okay.
We'll be taking questions for a minute or two just now. If anybody has any other questions, ma'am will answer them. There's one last question in the rack.
Yeah.
From Shruti. Is there any vaccine for breast cancer?
Not yet, but research is happening. We should have one within 10 years in this decade, hopefully. Research is happening, but not yet. Although we do have for cervical cancer, all of you please go and take.
Yeah, ma'am. Guys, if you have any other questions, you can raise your hand. The host will unmute you. Yeah, we have next one or couple of minutes. Ma'am will be there answering you. Or you can post your query in the chat box.
I don't think there are any more questions coming.
There is one question. I'll just paste it in the.
Sure.
Ma'am, by the way, baby is so cute.
You want to say hi? Say hello to everyone.
Hi.
Say hello. You want to hear? Okay. See, everybody is saying hello to you. Say hello.
Hello. Hi.
Yeah, there's one question. Prachi has asked this. So, do period or complications like PCOD, PCOS, or endometriosis increase risk of breast cancer?
No, there is no direct link between PCOS or endometriosis with breast cancer. Not at all, no.
Okay, ma'am. I think like we have all cleared. You answered major of the questions. Yes, Prakha, you can continue.
So yeah, I think now with this, it's all cleared up. We have come, we are upon to the end of our session. And personally, ma'am, I would really like to thank you. I mean, ma'am, we are all engineering students, so we have very little, we are really amateurs, not even amateurs. We have very little knowledge we have very little biological knowledge. And today, I think we have gained a lot. You have taught us, you have told us a lot, and I thank you for that.
Yes, ma'am.
No, it's very commendable, for at such a young age, you all are so interested in spreading awareness, in learning. It's very good.
Yes, ma'am. This was a small initiative by us. And ma'am, like really, it was very informative session from me and from everyone who is watching. And we all are glad that we are getting to leave with more than what we came here with today. So ma'am, really, as Prakhar said, we are really, really grateful to you. As an engineering student, we don't have much knowledge, but with your presence, you took your time out from your busy schedule, and for that thing we get to know a lot about breast cancer, and yes, we will take precautions. And thank you for making this evening so
The pleasure was all mine.
Thank you so much.
Thank you. So I don't think Professor
He has left.
Oh,
Yes.
okay. No problem.
Okay, thank
So,
you. Bye.
Thank you, ma'am.
Wait, ma'am,
Yes.
before you leave,
Yeah, ma'am,
we have a small thank you note for you. Just a second,
Yes.
I'll be sharing that.
Yes, ma'am. Just a cute surprise.
So, is this
Oh,
visible?
wow. Yes,
So-
it is. Thank you so much. Could you send me this?
Yes, ma'am. We'll surely be sending you this.
Yeah. Thank you.
This is a small thank you note from us for
you.
taking time out and helping us spreading awareness.
Thank you so much. Wow.
Let's also present the credit here. This digital art has been created by Shivangi Anand, I guess. Is
Yes.
she here? If she could be unmuted, that would be great. If she is here.
Shivangi, you can raise your hand so that Shivani can unmute you.
Okay, maybe she's not here, I think. That's no problem.
No, she's not there. Yes.
All right.
Thank you so much for this. Thank you.
Thank you so much, ma'am.
Thank you, ma'am. Thank you so much.
Thank you.
And for everyone, we will be meeting you soon with our next event. Hopefully, till then, hopefully you stay safe and stay happy, and ultimately have a smile and stay sanitized. Thank you all. Bye.
Bye everyone.